Hi, my name is Alexis, and I'm going to go over a case study regarding Antoine. He is an 8-year, 3-month-old child who was referred to speech therapy by his second grade teacher. It was observed that he has difficulty with reading comprehension and fluency, spelling, sounding out words, writing, and word finding. It was mentioned by Antoine's father that 6 months ago he received a concussion after he fell off of his bike, and it took him a few weeks to fully recover. That being said, for the assessment plan, I have chosen the oral and written language skills assessment that will be used to assess his language because it assesses all 5 areas that Antoine struggles with, which would be oral language, written language, receptive processing, expressive processing, and overall language processing. This will allow us to have a better picture of how we can better assist Antoine in his difficulties with comprehension and just everything really that's going on. As far as communication modalities, it doesn't seem like Antoine is really in the market for an AAC device or needs to learn sign language. If that becomes a problem, that's something that can be reassessed later on. For articulation, we are going to do the Goldman-Bristow test of articulation. That's just something that we're going to assess because Antoine does struggle with spelling. So, curious to know if it's because maybe he mispronounces a couple words and he just struggles with the association, or if it's just more language based. As far as fluency, voice, and hearing, those are all informal assessments that will be conducted. There are no concerns mentioned in any of these areas. That also includes feeding and swallowing. As far as cognitive and social aspects, there's also no areas of concern. And for cognitive aspects, if everything looks well with the other 2 assessments and there's nothing that shows of concern, then everything's good. If there's anything that we are concerned with after doing the OWLS or the Goldman-Bristow, more specifically the OWLS, we could make a psychology referral. As far as the treatment plan goes, I plan to use a speech-to-print word structure approach. This is something that was mentioned on the ASHA website, and it is a way for Antoine to practice reading decoding that can help with his spelling, also his reading fluency. Another approach that can be used is the language comprehension approach, since Antoine struggles so much with comprehension. And when he demonstrates comprehension of these short sentences and stories that we will start out with, we can then progress to longer stories and paragraphs. It's possible for us to modify instructions for Antoine to understand them before we can move on to multi-step instructions and comprehension. Short passages and just repetition of those will be a good starting point to improve Antoine's reading fluency. That's something that will also come with being more comfortable reading aloud and things of that sort, especially since he's 8. As far as articulation, we can work on a multilinguistic and multimodality approach. It's also mentioned from ASHA's website. This will allow us to work on the phonological and semantic components, and this will help Antoine process the phonemes while visualizing the letters, which will help him become a stronger speller. As for goals, I have that Antoine will be able to independently follow multi-step directions with 80% accuracy by the end of the school year. Seems very attainable. Another goal would be that Antoine is able to improve reading fluency by using context clues and phonemic skills with 80% accuracy by the end of the school year. These are two goals that are very important and can help Antoine in all areas that he has difficulties with.